64? This data, which I just measured in 30 seconds, predicts my risk of cardiovascular death better than cholesterol or blood pressure. And nobody uses it when I talk about resting heart rate, a biomarker you'll never forget. I'm Dr. Borja Bandera, and I've spent a decade helping you avoid disease. In today's video, you'll learn how to properly measure your resting heart rate. It's not that easy to understand, also because it's crucial for your health, and more importantly, you'll get a practical guide to lower it in record time. The first thing you need to understand is the physiological range of heart rate, which ranges between 60 and 100 beats per minute. Above 100, we're talking about tachycardia, and there are many types of it. Below 60, it's bradycardia. Well, we know that within that normal range, for every increase of 10 beats per minute in your resting or basal heart rate, cardiovascular mortality, increases by 8 to 17%, and all-cause mortality increases by 9 to 22%. How can this be? That's what you're going to understand today. Also, the dose-response relationship is linear, it's independent of other cardiovascular risk factors, and it's present in both healthy populations and those with cardiovascular disease. Quite a biomarker, right? We're going to explain all of this. Look at this massive study conducted in 2 cohorts, one European, Norwegian, and the other Asian, in Taiwan, with no less than 692,217 adults, very large. What was observed was that an elevated resting heart rate from 80 to 99 beats per minute, it conferred a higher risk of mortality than another well-studied risk factor, hypertension. This will also be even more true in the 20-year-old age group. But in addition, it also predicts non-cardiovascular mortality, including breast, colorectal, kidney, and lung cancer. This suggests that we are not just dealing with a simple cardiovascular risk marker, but rather a marker of overall well-being and general health, despite how simple it is to measure. Years and age of, and in the 21-year-old age group and in the age group. It is usually justified because of its high variability and the influence of comorbidities on this factor. So if we need a paradigm shift, that's why I'm bringing you this information. You should definitely know your resting heart rate first, and secondly, lower your resting heart rate. And that's what you're going to learn to do right away. But you might say, Borja, why is this data so important? Well, because in a single metric, it gives us a lot of information. Look at this. The higher your resting heart rate, the less coronary perfusion time you have. Do you know at what point in the cardiac cycle the heart is perfused? That is, when it receives blood through the coronary arteries? Because of course, the heart pumps blood to all the cells in your body during systole, but also, as an organ, it needs to receive oxygen and nutrients. Well, that supply happens during diastole, when the heart relaxes, which occurs when we have a very high heart rate. Diastole gets shorter, and therefore the time during which the heart is perfused also gets shorter. It drops a lot and gets little nourishment. It's a heart at risk, but also there's excessive sympathetic activation. When we have an elevated resting heart rate, a baseline heart rate above 80 beats per minute, it reflects sympathetic predominance over the parasympathetic. This chronic sympathetic excess promotes a larger left ventricle, endothelial dysfunction, greater predisposition to clots, kidney damage, and a tendency toward lethal arrhythmias. We've explained this in many videos. Stress can kill you. In this recent video, I talked about 10 subtle signs of chronic stress that you need to know. The higher your resting heart rate, the lower your VO2 max. It's no coincidence that the best endurance athletes on the planet have absurdly low heart rates. Miguel Indurain had 28 beats per minute, Eliud Kipchoge around 35, Chris Froome 38 to 40, and Michael Phelps was about the same, around 38. ¿Por qué? Even though we previously said that the lower limit of a healthy heart rate is 60, there is a major exception called physiological bradycardia, which occurs in very well-trained hearts. These hearts are so efficient that they have to beat much less to supply blood to all the cells in the body. And I was saying that it's no coincidence that the best have such low heart rates. Because this data correlates very well with VO2, that is, with the aerobic engine of athletes. A high VO2 max is also another risk factor, or rather, in this case, a protective factor against mortality. And increasing it, just like lowering your resting heart rate, is one of the best things you can do in life to stay away from disease and live longer. I'll show you how to increase it in this video. Increased vascular stress and arterial stiffness. The higher the heart rate, the more tensile stress on the walls of the heart's arteries. The endothelium, the coronary lining, is exposed to more shear stress, which are oscillatory shearing forces, a pro-atherogenic mechanical pattern. But in addition, a high heart rate gradually causes the elastic fibers in the walls of peripheral arteries to break down. What happens if these fibers break down? The stiffness of the arteries increases. Stiffer peripheral arteries increase the afterload of the left ventricle, meaning the force that the left ventricle has to exert to eject blood throughout the entire arterial system. And we come back to the same point. The heart has to work harder to do its job. The lifetime heartbeat budget theory. There is a semi-logarithmic inverse relationship between basal heart rate and life expectancy, which also remains constant across species. The total number of heartbeats per lifetime is remarkably similar regardless of body weight. Very interesting. What does that mean? Esto, que cuanto más despacio gastes tus latidos, how long will you live? But Borja, then I don't have to exercise, I don't have to do endurance training, because that will speed up my heartbeat and use it up faster, right? You don't have to see it that way. Training, even if it raises your heart rate for an hour a day, or an hour and a half, or half an hour, whatever it is an investment. So for the rest of the day, your heart rate will be lower. Let's do it with math so it's clear. Sedentary person A has 80 beats per minute without training throughout the 24 hours of the day. That's 115,200 beats in a day. It's not a very precise number because this obviously varies. We're not robots. Person B, who trains and does endurance training, trains for an hour a day and gets their heart rate up. During that hour, let's say their heart rate is at 130 beats per minute. That's 7,800 beats in that hour of training. But for the rest of the day, their heart rate stays at 60 beats per minute because they have a well-adapted heart. So in total, they use 90,600 heartbeats per day. That's a saving of more than 25,000 beats in a single day. That's the difference, which also becomes a compounded difference over the years and decades between being a trained person and being a sedentary person. Training is an investment. It doesn't take your time, it gives you more. In conclusion, it should be very clear to you. Your resting heart rate reflects the health of your nervous system, cardiovascular system, metabolism, and inflammation in a single metric. A simple, accessible, and elegant metric. It's an independent predictor of mortality because it reflects, at the same time, a state of sympathetic overactivation, autonomic dysfunction, higher hemodynamic load, and lower coronary perfusion. A pro-inflammatory and metabolically unfavorable environment that accelerates the progression of cardiovascular disease. Now then, how do we measure it correctly? Well, that's the best thing about resting heart rate. It can be measured easily. You need to assess it, of course, when your metabolic demand is at its lowest. When? Generally, right when you wake up before having coffee, tea, mate, or any stimulant. Very important. Now then, there are two situations I see here. People who have a smart device and people who don't and have to take a manual measurement. Let's start with the latter. First, empty your bladder. A full bladder increases blood pressure and heart rate due to sympathetic stimulation. Then lie on your back or sit semi-upright with your back supported by a pillow. Use your index and middle fingers, never your thumb, on the radial artery, here below the base of the thumb. It's much better than on the carotid because if you stimulate the carotid sinus, which is around here, you'll artificially lower your heart rate. You'll get a falsely low result. Don't count for 10 seconds and multiply by 6, which is what people usually do. This has an error of about 6 beats more or less. That's quite a lot. The ideal option would be to count the full 60 seconds or alternatively count for 30 seconds and multiply by 2. Keep a natural breathing pattern while counting. Don't force deep breaths, which is something people often do, because you won't do it for the rest of the day and you'll get a false result. If you force your breathing, your resting heart rate will go down, but it won't be representative. If you have a Garmin device, Apple Watch, Oura Ring, or any other, then what we're going to use is the watch. It should be one finger above the wrist bone and tight enough so that no external light gets in, because these devices measure using photoplethysmography. They use a green light to measure, if you notice. However, it shouldn't be too tight or cut off your circulation. Second, sweat and dirt on the optical sensor can cause noise in the signal. Third, lie down on your back again, and after a minute, check the resting heart rate shown by your watch. If the device gives you the average of the last week, that's a much better predictor, since it eliminates variables like a bad night's sleep. Also, it takes the average for the whole day. Be careful, because there are things that can greatly affect your resting heart rate. Alcohol consumption, even in small amounts, increases your resting heart rate due to vasodilation. Intense training increases it due to the EPOC effect, stress and anxiety for obvious reasons, or dehydration, which reduces stroke volume. The variations from your baseline are very useful. For example, if you're 5 to 10 beats per minute above your usual average, it's often an early indicator of overtraining. You're overdoing it with your training load and volume. Or an imminent infection, like in my case, I have a cold right now. My resting heart rate is between 5 and 10 beats above my usual rate. Or it could simply mean you're stressed. You have a very high allostatic load. It's a piece of information you can also use together with HRV, heart rate variability, to make better decisions. Now then, Borja, what is my goal? What am I aiming for? Where should I set my baseline heart rate? Well, this is debatable. We can say that below 60 beats per minute is optimal, as long as there isn't a condition causing bradycardia, a bundle branch block, or any other cardiovascular disorder. In other words, what we want is to develop physiological bradycardia through cardiac adaptation. And you don't have to reach elite-level bradycardia, like that of elite cyclists, obviously, but if you're able to be between 40 and 50 naturally, this speaks of a very efficient heart. But as I said, below 60 is already great. Very good. Between 60 and 70, well, this is where most active and trained people would fall, and it's a very good number. You already have less risk than most of the population. Between 70 and 80 would be people who, well, train from time to time, but generally aren't very consistent and don't stick to training very well. And above 80, that's when you really need to worry. It's actually an alert level that, according to the guidelines and what I learned in medicine, would be considered totally normal. But we know with current evidence that it's not. It usually corresponds to sedentary people, and from here on, as I said, the cardiovascular risk increases considerably. If your resting heart rate goes over 100 beats per minute, then a thorough evaluation should be done. We could have anemia, volume depletion, an infection, or any other intercurrent process. But it's not normal to have a resting heart rate above 100. Now then, how can you lower your resting heart rate? That's the most practical thing, right? Well, as you might imagine, the main pillar is aerobic training at different intensities. This will help you lower it most. Everything else is secondary. The core of your training should be Zone 2, where you'll accumulate at least 200 minutes per week. Yes, you have to do it. It's a very good investment. This would be complemented with high-intensity HIIT work, but only once or twice a week to avoid excessive sympathetic activation. If you overdo high intensity, you'll get the opposite effect. Yes, high intensity is very good for stimulating different adaptations, for increasing your VO2 max, but if you overdo it, in the end, due to sympathetic overactivation, you'll raise your resting heart rate. For example, what works very well for me is doing a Norwegian 4x4 protocol once a week to keep it simple. Then there are interesting interventions that you might not have connected to this, like the sauna. The sauna passively mimics exercise. The heat dilates the blood vessels, which reduces peripheral resistance. This makes your heart work harder during that time and actually has similar effects. At a temperature of 80 to 90 degrees with 3 20-minute sessions per week, you already achieve a lot. From this, what the evidence tells us is that there is no ceiling of benefit for sauna use. That is, if instead of 3 sessions you do 4, it's better. If instead of 4, you do 6 per week, it's even better. If you can alternate with cold water, that's even better. And you already know you have the code EMPODERA100 at Recovital to save yourself €100 on any of the saunas they offer. Plus, they'll set it up for you at home. And key micronutrients. For example, magnesium is the heart's natural relaxant. It helps regulate calcium channels. Omega-3 improves the fluidity of cell membranes in cardiomyocytes. Potassium is essential for the repolarization of the heart. How? Avoid stimulants. Look, if your goal is to reduce your resting heart rate, then you'll also have to cut down on stimulants like caffeine, especially in the afternoon. And the thing is, most of us don't know our real resting heart rate because there's always some stimulant circulating in our system. That is, if I measure it right now, like I said, I'm not objectively assessing my resting heart rate because I've already had a big cup of coffee. Do you understand? So that's it for today's video. You should know this number. It's very useful, very practical, and easy to measure. Tell me in the comments what your resting heart rate is. Don't lie to me. We're on YouTube. No one is going to judge you. Say it honestly. Tell us your resting heart rate. See you in the next video. A big hug. Thank you for subscribing. Very important. And let's keep empowering ourselves.